Hello, Assalamu alaikum, good evening one and all. It's my great pleasure to be a part of this webinar today, as mentioned by Mr. Sanket, Mind and Heart. Today we have our panel of doctors, Dr. Bigesh and Dr. Samin. And so can we begin the session, or shall I begin the questions? Okay. So the first question goes to our cardiologist, Dr. Bigesh. What is heart attack and what is coronary artery disease? Can you just give us a small light on it?
Thank you for the question. Heart attack or acute coronary syndrome is a condition when any one of the coronary arteries which supplies the heart gets 100% occluded either by a clot or by a rupture of a plaque followed by a clot, which results in reduced blood flow to the muscles of the heart, and that causes ischemic pain to the patient. Regarding stress and heart attack, what happens is there will be increased inflammation as well as increased blood pressure, which can cause the rupture of the plaque at an earlier and easier way, causing a clot formation. Psychosocial factors have been already a main proven cause of heart attack. When another situation, when there is an acute stress, there can be coronary vessel spasm, which can also lead to a heart attack.
Okay, there was a brief idea about what is heart attack or what is coronary artery disease. Now we have the first question to our psychiatrist, who is Dr. Samin. Dr. Samin, can you please tell us in brief about what is an anxiety attack?
What is an anxiety attack? So I want to talk about anxiety attack from a layman's perspective. So we always talk about panic attack, anxiety attack, very loosely. So what is an anxiety attack? I mean, for each and every person, I would say the anxiety attack is different. For some people, it is, some tightness in the chest. For some people, it is undescribed fear. They'll say that, I don't know what is happening. I have this intense fear, which I cannot explain. Often they come to our OP and they say that, I cannot explain what's happening to me. It is some fear, but I don't know what exactly this fear is. I cannot explain it to you. That is when I come in and say that, do you feel that is it something like something is going to happen to you? You feel as if something is going to happen to you, or you're going mad or something. They'll say, yes, doctor, yes. So that is how generally people say, I feel as if something is going to happen to me. And one important aspect of this anxiety attack is, people who are, close to them, or people who are at home, they won't acknowledge this. Often it is that severe that I wouldn't compare it to a heart attack, but at least for the patient who is experiencing it, the person who is experiencing it, it is very, very difficult. Suppose you have a car accident, or you met with an accident or something, you have anxiety, right? You'll have an anxiety at that point of time.
Yes.
Some adrenaline rise and all those things. Imagine that 100 times multiplied. That is how a person with an anxiety attack will experience.
The heart rate increases.
Yeah, a lot of
sweating.
physical symptoms as well. It's the fight or flight response that we usually say,
yes,
wherein you want to escape from that situation. Your heart rate is going up. You may sweat. You may feel like going to the loo or
yes,
going to the toilet.
Yes.
You just want to escape from a situation like that. So again, like I said, it varies from person to person how they present with anxiety. Some people may feel as if they don't have enough, they're out of air. Mm-hmm. They have this hyperventilation. Mm-hmm. They have difficulty in breathing. Yeah. That is when we use all these, bags,
yes,
paper
yes,
bags and all those things that we usually see in movies and stuff.
Yes.
So all those things are generally the presentations of anxiety attacks.
Okay. Can you tell us some situations where a person could experience an anxiety attack? Like you said, a car accident. What are the other situations where a person could experience anxiety attack?
we know about phobias, right? People have phobias, as in when you go into a closed space, you can have phobia.
Yes, yes.
Situations like that. In phobic situations, you can have anxiety. You can have anxiety attacks in, life situations or life events, like death of a close family member, losing somebody very close to you in your life. All such events in life can also cause. And one important aspect of anxiety attack is sometimes you don't need a reason. Often they come and say that, I'm just sitting and doing something. Suddenly, out of nowhere, I'm having this anxiety attack. So it's not necessary that you need to have a trigger to have an anxiety attack. So yeah, that's how it is.
Okay, thank you so much for the answer. Now we'll go to Dr. Bigesh. Can you explain to us what are the psychosocial factors that could affect the heart?
Psychosocial factors were very well explained in the Inter-Heart study, which was done for nearly 22,000 patients over 52 countries. The psychosocial factors are anger, hostility, depression, and anxiety. Actually, what was found was very much interesting in the study. The modifiable risk factors, as we know, dyslipidemia, psychosocial risk factors, diabetes, hypertension, as well as smoking. In this, if we see, the psychosocial risk factor comes second. The first one is dyslipidemia, that is 3.6 times the chances, the fold of having a heart attack is high in dyslipidemia, as everyone knows. But nobody expects psychosocial risk factor as the second most prominent one. That much important is the psychosocial risk factor for the heart attack part. I hope it explained you.
Yes. Now we all are aware. Before we used to think, like as Dr. Bigesh mentioned, that it's only obesity or hypertension or other factors which basically is got nothing to do with mental health, has got to do affect the heart. But now we know that also psychosocial factor is a very important thing to cause any cardiovascular disease or even a heart attack. Now the next question is for Dr. Samin. What is the linkage between personality of a person and heart attack? Could you just give us some light on that, Doctor?
So when you talk about personality, we need to know what a personality is, right?
Yes.
So basically it's a sum total of our character, what dictates how we behave, how we manage our emotions, how we cope with different life situations, all those things. It's not necessary that a person gets fit into just one particular personality. So there are different personality types. Generally we can, say type A, type B, type C, like that. So there are some people who come under this type A personality. In fact, this relation between type A personality and cardiac issues was first found by two cardiologists, by name Friedman and somebody else. They found that some patients who are hypertensive, they found that in their outpatient department, sofas like this are there, right? So they found that people who are generally anxious, they start scratching the edge of the seat.
Yes.
So they find that they have to keep changing the sofas very frequently. When they found out that these people are generally anxious, they can't wait for long, like that. So they understood that, okay, there could be a personality involvement in understanding how it works. And like Dr. Bigesh has already mentioned, he's mentioned about hostility and other factors. So this hostility factor comes into play in this people with type A personality. As in they are the ones who are, like, we call them ambitious people. William Osler once told that people who have heart disease are go-getters or ambitious people,
Okay.
So basically who are very hostile, who are on the edge, who are considered to be very efficient, they spend all the time for their work and all those things. Such people are considered to be at high risk of developing cardiac issues.
Dr. Samin, can you give us just a brief idea on what is actually type A, what is type B, the personality? Because many people just keep mentioning you are a type A personality, but most of them don't really know what that actually means.
Actually, this classificator systems are also so many types of classificator systems are there. I just mentioned one of these because there are other classificator systems as well. Type A is basically who are like go-getters and ambitious people and all those things.
That, yeah.
Type B are basically who are very laid back, who don't care about what's going on around. But they'll be very good in their work and all those things. Some categories are, very disruptive sometimes. The thing is, it is very difficult to mention about different personalities without taking into consideration each and every person. Because if we say that this is type A, this is type B, people will start assuming, okay, I have type A, type B, like that. But the problem is, a single person can be fit into different personality traits based on, that will be a wrong information to give if you give out all the information regarding different personality types.
Yes.
Yeah, if you have a problem, obviously we'll be able to understand what is going on and settle it. Yeah.
Okay, yes. And can you tell us what are the major causes which could lead to depression and anxiety?
When we talk about depression, when we say that somebody is depressed, what do we think of generally?
And the person is sad all the time.
Why is a person, generally we look for reasons, right? Okay, why is that person depressed? What are we generally looking for sometimes? Usually, as a lay person, if you think of yourself as a lay person, what do we think of? Okay, that person is depressed. Okay, what is the reason why that person could be depressed?
Any reason.
Usually we say that there'll be something going wrong in their lives, right?
Yes,
they must be going through a breakup, or something must have happened in their lives.
They must have lost a loved one, a relative,
yeah, they'll talk
about divorce. Or
yeah, some stress going on.
Yes.
All of us will have some of the other stress going on in our lives,
yes,
right?
Of course.
But what I want to tell is, for a small, at least, I would say, majority of the depression that we see in our OPD and other situations, you don't need a reason to cause depression. What I'm trying to say is, even if everything is fine in your lives, you have enough money, you have Land Cruiser, you have a good family life, everything, but in spite of all that, you can have suicidal thoughts. You can feel sad, you can feel anxious, you can feel agitated, you can have all these emotions, emotional roller coasters without any stress. So what I'm trying to say is, just like we have other physical conditions like hypertension, diabetes, and all other medical illnesses, same way, the reason why we get majority of the depression that we get is because of some brain chemicals. There are these chemicals in our brain, you could call them hormones maybe, like serotonin, dopamine, and other chemicals.
Yes.
So in different points in life, what can happen is there will be ups and downs of these chemicals. So when it goes very low, you can have depression, anxiety, and other conditions. When it goes very high, you can have episodes of anger, agitation, irritation, and all those things. So that is one important aspect of why you get depression and anxiety. Of course, like any other physical illnesses, we have other factors as well. Like, heredity plays a role. If you have your parents going through hypertension or diabetes, it's quite possible that we also acquire that. Same way, heredity plays a role in depression, anxiety, and other psychiatric conditions as well. You have other substance abuses like smoking, alcohol, all such things can cause. So a variety of factors, including environmental factors. We talk about post-traumatic stress, life-threatening big life events that's going on in your lives can also trigger. So a lot of factors, in fact, yeah.
Okay, thank you so much, Dr. Samin. Now, Dr. Bigesh, can you just tell us how is stress and anxiety linked to heart disease?
Almost every one of you who is listening might be at least once anxious in your life. Including us three, when we are sitting here, we are still anxious. But this anxious is very normal because it increases the productivity. But when it starts affecting our daily activities, then it becomes a disease. So anxiety disorder, there are studies, meta-analysis, where anxiety disorder patients has been shown to get at least 36% of those patients are getting nearly heart attacks as well as coronary artery disease. The same way, a patient who is already having a myocardial infarction or a heart attack, when they become anxious, they are getting into heart failure as well as sudden cardiac death also. The percentage is nearly 20 to 25%. So that much importance is anxiety linked with heart disease. Another thing what I would like to say is, Many of the youngsters, males who, as well as females, who come to OPD, especially during COVID time, what we have noticed is they complain of chest discomfort, high blood pressure they have, heart rate will be around 100 to 110, 120, sweating, all typical features of heart attack. But when we take an electrocardiogram or an echocardiogram or do the cardiac enzymes, everything is normal. This is a typical pattern of panic attack which we need to recognize in the OPD and not send them for an angiogram for sure. So, but still, panic attack, we cannot take it lightly. There are cases where patients who are prone to cardiac arrhythmias end up in supraventricular tachycardia or maybe cardiac arrhythmias, maybe predominantly that also we have seen in some patients.
Okay, thank you, Dr. Bigesh.
I think I'll add something to that as well.
Yeah, sure.
Since you mentioned about this. I think what is important is when somebody experiences something which looks like a panic attack or something which looks like a heart attack, the first and foremost thing that a person has to do is see the cardiologist. You know, you need to rule out whether it is you just can't be, you know,
Of course,
yeah,
classified as a psychiatrist.
Yeah, exactly. You get an ECG done, you know for sure that, okay, this is not a...
The cardiac issues are...
Yeah, and it becomes even more tricky if the same patient has both hypertension, panic attack, and everything together.
Yeah.
It becomes very difficult. So it's always better to have a general evaluation, because even another thing, if it's something else, it's, I mean, gastroenterology. I mean, many patients who come with depression, they present with gastric symptoms.
Yes, like IBS.
They go to gastroenterologists, they do all the scopies, everything will be normal, and they come back to us. So it's good practice to go and see. It's better than avoiding it. Yeah, exactly.
Clear that your cardiology side is clear.
Correct.
Before they seek only psychological help as well.
Panic attack, nothing is going to happen eventually, but...
If there is something related to the heart, of course it could lead to the person's death. Dr. Samin, can you tell us how to manage panic attack?
How to manage a panic attack. Then again, it's like, you know, like I mentioned earlier, each and every person's panic attack is different. So when it comes to psychiatry, when it comes to depression, anxiety, we consider each and every patient is different. The kind of panic attack each and every person experiences is different. Their depression is different. How the depression affects them in different aspects of their life is different. So it's basically what we do is we do a tailor-made treatment. Generally what we tell them is like, what do we do generally when you have an anxiety attack? What will be a normal person's perspective of how to manage a panic attack? You'll try to distract yourself, right? Yeah. Maybe I'll do something else, I'll listen to music, or I'll spend some time with friends, all those things. But the thing is, these concepts keep evolving day by day. Earlier it was always about distraction and all those things, but nowadays it's more about being in that moment. If you're doing something and suddenly you get a panic attack, it is advisable that you continue to be in the moment, experience what you're going through, so that you know that nothing is going to happen. If you're aware that, okay, I'm in this moment, nothing is going to happen, they'll be more comfortable that next time, okay, I know, I have been through this, nothing is going to happen. So being aware of that situation and being there is the first thing. Second thing what we can do is we can do some breathing techniques. These are all things that we know on a regular basis.
Yes.
So breathing technique as in, basically you can breathe in.
Fasil's movie which says breathe in, breathe out.
Who's Fasil?
Oh, really?
So breathe in, meaning breathe in through the nose, very slowly and steadily. You focus on your breath properly. Then breathe out through the mouth. So all making sure that you're focused on these things. Some people talk about this 5, 4, 3, 2, 1 things, wherein you look for 5 things that you can see, 4 things you can hear, like that. That can also work in some situations. So basically the new consensus is that you be aware of the situation and understand, okay, this is what is going on with you. You need to be present in the moment. You need to be aware of what's going on to your mind, what's going on to your body. And being aware in that situation helps in a major way. And if it is too much, then definitely you'll have to get a professional help.
And do people have with panic attacks, all of them need to have medications, or it depends on how severe it is?
It depends on how severe it is. The simplest way to talk about when to seek help when it comes to any sort of mental illness for that matter. We all go through these emotions. We all go through happiness, sadness, irritability, anger, anxiety, all these things. So when do we seek help? So when do we seek help? When it starts interfering with your daily functioning to that extent. It could be in the frequency of such episodes. It could be in the intensity of such episodes. In such cases, you seek help.
Okay. Okay, thank you, Dr. Sameed. Now, Dr. Bigesh, can you tell me how does depression affect heart?
Yeah, depression and heart, there are studies like heart and soul study which was done prospectively over a period of 10 years. It has shown that depression and depressive patients definitely develop heart disease, around 90% probability and chances of getting a heart disease, especially heart attack, is very high. And the reason what they project is because of the both biological as well as behavioral problems. What is biological problems? Like what happens is there will be increased cortisol level, noradrenaline, reduced vagal tone, as well as inflammation will be very high in these patients. And these patients, what we can find that the behavior wise, they eat more, they don't exercise, and they smoke also. So all these are risk factors for heart disease and heart attack. And not only this, if you see the heart attack patients or post myocardial infarction patients, nearly 25% of them are depressed. So that also has culminated in lot of patients getting into heart failure as well as sudden cardiac death post-MI. So we consider depression, very few people do think on that line, but definitely yes, these are very important causes and very important, much more than ejection fraction and other signs of ischemia like the treadmill test, all those tests. More than that, depression definitely holds a higher level of assessment. That's very important because this is heart and soul study that this study proves on that aspect.
In fact, I've seen some studies also, like, many people have conducted studies in post, MI or post heart attack patients. They have done like some counseling or some cognitive behavior therapy, CBT, and all other techniques have been employed, and found that people who had CBT or they underwent therapy or counseling had a better cardiac status than people who didn't undergo in this one, CBT. It's always a chicken egg dilemma usually, which came first, depression or cardiac problem. Yeah, and in fact, many of my patients, when they come and sit in the OP, they'll say that I have BP. I have increased pressure. What they meant is I get angry fast.
Yes.
I'm like, what?
Like
are you in the wrong OP? Yeah.
Okay. Now, Dr. Samin, can you tell us what is the role of substance abuse and mental illness?
Substance abuse is a problem for any illness for that matter, cardiac or otherwise. Yeah, one important aspect when it comes to substance abuse and mental illnesses, often what do we think? Okay, when they come to me, they'll say that, okay, I take alcohol, I take nicotine, I take the occasional other substances as well, but I don't take it in excess. That's what they say. So there is this concept that you will have a problem only if you take things in excess, which is absolutely wrong. Because first of all, the same amount of alcohol or the same amount of nicotine going into different people will have different health implications, mentally as well as physically. That's why we see that many people who take a lot of alcohol may not have any physical problems sometimes. Exactly. Some people who take a small amount of alcohol can have liver cirrhosis and whatnot. So it's not based on the quantity of alcohol you take, how it's affecting you physically or mentally. So all the substances, as in it could be nicotine, it could be cannabis, alcohol for that matter. Alcohol is a brain depressant. So any amount of alcohol you take, what will happen is all these chemicals we talked about, the serotonin, dopamine, all these substances go haywire, and it affects the mood as well. Many patients can have substance-induced mood problems, substance-induced psychotic problems as well. I have seen a medical student, in fact, who had one joint, as in one smoke of cannabis. He has become psychotic for life. So see, these things can affect in a negative way, even if you take a small amount or a higher amount. So it depends on how it is affecting you. So I would say all substances affect this in a negative way, mental health especially. If you have some sort of mental illness, it's better to avoid taking even in small amounts. Another problem is it can interact with the medications. You're giving a medication for anxiety or depression, and your patient is going to take alcohol or some other substances. It's going to interact with the medication. The levels of absorption of the medication can be changed because of these things. So all these things are very important.
Okay, all right. Thank you, doctor. Now, Dr. Bigesh, can you tell us what is the linkage between stress, palpitation, and cardiac arrhythmias, please?
As I have previously mentioned, stress, anxiety, both increases the adrenaline rush. So whenever there is an adrenaline rush, the heart rate is going to increase, and an abnormal feeling of that beating is known as palpitation. Most of the anxious patients definitely do tell that one of their main symptoms is palpitation. But what we should understand is, when there is a sudden adrenaline rush, especially in patients who are prone to get arrhythmias, like a supraventricular tachycardia or maybe a RVOT tachycardia or any sort of tachycardia, a single VPC may be enough to trigger that. So it is very much, I can just say that it definitely, anxiety can increase the probability and presentation of patients with arrhythmias. In the same way, patients on medicines for supraventricular tachycardia who are anxious, we have found that it is very difficult to control with beta blockers, even though beta blocker is almost decreases the effect of the hormones, but still we have found that if the patient is anxious, they have recurrence of cardiac arrhythmias, especially supraventricular arrhythmias.
Okay, thank you, Dr. Bigesh. As we all have heard that exercise, mainly you hear one of the most important advice which your doctor could give you as a physician as well is that to exercise in order to get your diabetes, your hypertension or your obesity under control, do exercise. We usually talk about the physical part of it, but Dr. Samin, can you tell us what is the benefits of exercise in mental well-being, or how does it help us to be mentally well?
Again, like we mentioned about these hormones or chemicals in our brain, which could be called as happiness hormones. When you get going, when you do some sort of physical activity on a daily basis, one, it forms a part of a routine. So you're not able to wake up in the morning, you're not able to go. Often what happens in depression is, you don't have the motivation to do simple things, like, get up, get going and do things. Yes. So when you have a routine, when you do some sort of exercise, it's not necessary that you do heavy lifting or you do it for 2 hours or 1 hour or something like that. If you stick to a schedule and do it for maybe 15 minutes, 20 minutes itself, that plays a major role in getting back into mental shape, not just physical shape. Again, when it comes to the hormone part, what will happen is there are a lot of happiness hormones that gets released when you do exercise. What happens is, in many cases, when it comes to depression and anxiety, you will have muscle tension in different parts of the body. They come and say that I have pain in the back of the head, pain in one arm, which could often be misconstrued for a cardiac pain. Yes. Because you see every now and then you see on the media, if you have a left-sided pain, you have to be very careful.
Go to the cardiology
yeah.
immediately.
So based on that, they can have pain in different parts of the body because there is muscle tension over there. So to release that muscle tension, to make you feel at ease. So in all those aspects, exercise helps.
Okay, all right. Dr. Bigesh, can you tell us the relation between stress, female gender, and heart?
Yeah, that's a good question. Actually, usually schizophrenia or chitta brahmam in Malayalam, we say, it is more commonly seen in males. But there are conditions where acute stress can affect the females, especially leading to heart failure. So what is happening here is when a patient is having an acute stress due to different reasons, maybe a loss of her husband or any emotional stress what she is undergoing, she will present with typical symptoms of heart attack and heart failure. On examination, we can see that the troponins, the enzymes, cardiac enzymes are elevated. When we do the echocardiogram, we can see that the heart function has come down. There is apical ballooning of the left ventricle, and we call it as even Takotsubo cardiomyopathy or broken heart syndrome. This is especially common in young females, usually seen between 30 to 50 years. In males, we have seen another group of variety of LV dysfunction, that is a mid-ventricular dilatation in acute stress. But more commonly, this acute stress is related to female gender, presenting with Takotsubo cardiomyopathy.
Okay, doctor, thank you. Now, Dr. Samin, can you tell us why it is important to treat mental illness from the physical illness perspective?
See, often, many times what happens is when a patient comes to me with depression or anxiety, we often ask whether are you on a treatment for hypertension or diabetes, thyroid. I'll write in inverted commas because it's very important when it comes to mental illness. Because any patient for that matter who comes with anxiety and depressive symptoms for the first time to the outpatient department, we get a thyroid status done immediately because that is very important. Because most of the symptoms of depression and anxiety can be mimicked
related to thyroid
as well. And often what happens is when you have depression, anxiety, you will start ignoring everything. You'll start ignoring your physical illness, you'll start ignoring that you have hypertension, you stop taking your medications on time. So in effect, that will affect it's like a cycle. Yeah. You ignore your cardiac status, you ignore your hypertension, you don't take your medications on time, your blood pressure goes high, you can have anxiety again, all those things can happen. Then not just cardiac, I would say all aspects of physical status also become more sedentary, they won't exercise as much. Being sedentary can lead to obesity or other illnesses as well. So it's like a never-ending cycle wherein you end up having a lot of other physical illnesses as well.
So that's how important mental illness is connected with physical illness. And now, Dr. Bigesh, can you tell us what is the possible lifestyle changes for stress reduction in case a person is having a heart disease?
Usually the lifestyle changes, what we advise for any cardiac patient is a healthy diet, especially following a Mediterranean sort of diet where there is fruits and vegetables along with salmon and use of olive oil for the purpose of omega-3 fatty acids also. It has anti-inflammatory property, and indirectly stress increases inflammation, and this diet will definitely help to reduce the inflammation part. Exercise is a second most important lifestyle change, what is very much effective for anxiety as well as depression associated cardiac diseases. Exercise can be told as 4 different types. One is the aerobic exercise, where the first 10 minutes of your exercise will be warming up. And the next second 30 minutes will be your maximum brisk walk mode, where you will try to attain at least 60% of your target heart rate. Target heart rate is calculated by 220 minus the age. So if a person is 40 years, target heart rate comes to 180. So 60% at least you need to achieve by a brisk walk in the next 30 minutes is very important for cardiac health. And the last 10 minutes will be a cooling phase. So this is how you have to do, the way you have to do the aerobic exercise. Rather than going to gym is very good, but doing heavy exercise may not be that much helpful to the heart part for sure. The next type of exercise is resistive exercise, or exercise where there's a little muscle building part is also there, which will help to increase the insulin sensitivity, especially for a diabetic patient. So that definitely helps to increase the self-esteem of a person also. So that also helps in reduction of depression as well as anxiety on a long-term basis. The third most important thing is the yoga or any sort of exercise with meditation, which will definitely, the stretching type of exercise with meditation, which can definitely reduce the anxiety component. Especially there are two types of personality. The hyperactive personality will be benefited with Shavasana sort of yoga activity, and a person who is depressed will be more helped with a pranayama sort of yogic activity, pranayama sort of breathing activity. The fourth important thing is a breathing exercise. A mindfulness is the ideal term to say a mindful breathing exercise. What do you mean by a mindful breathing exercise? Mindfulness means you are not at all thinking about your past, you are not thinking about your future, you are thinking about the present while you breathe. And the pattern will be like you will be concentrating on your breath only. How do you do that? Keep your left arm or left hand on your chest, the right one on your abdomen. When you take a breath, the breath should be taken through the nose, and if you want, you can even count 5 counts, reverse counts, you can count so that your concentration will be on the breath. And the moment during inspiration, the diaphragm should go down and the abdomen should come outwards. And when you then you have to hold it for next 4 seconds. Then after that, you have to exhale for a duration of 7 seconds through the mouth. If you can perform it at least daily 15 minutes in the morning, the whole day of yours will be definitely a blissful one for sure. Try to practice this over a regular period, these 4 types of exercises. The anxiety component and the depressive component as well as the cardiac health will be definitely much better. The third thing is stop smoking. As Dr. Samin has said, all addictive substances has to be reduced, and control of diabetes, hypertension as well as cholesterol is a very important thing for cardiac health, and a very good sleep, which we always forget. At least 8 to 10 hours of sleep. If a person can have uninterrupted sleep, the next day will be a pleasant one for these people. So this should be definitely help a lot of people, and this may be taken as a lifestyle change for all people who have anxiety, depression and cardiovascular disease.
Thank you, Dr. Bigesh. That was really nice. We had got so many points, and hope most of us will stick on to it and try to do the exercise that he just mentioned so that we'll have a pleasant day ahead. Now, Dr. Samin, can you tell us some modifiable risk factors that can improve the psychological issues that we come across in our daily lives?
That is a lot comes under whatever he has mentioned as
Yes, I know,
well.
but can you just tell
Yeah,
it from
just briefly, what I would say is, not thinking too much about the future, not thinking about the past. It is very much important. There are many things which are not under our control when it comes to our daily lives, right? So we don't look at whatever variables we can't control, look at what we can control. See, one important aspect I would say is, suppose some student is coming to me saying that I wanted 100 marks, I got only 99. They are under more stress than somebody who just passed.
got 50.
Who got 50, they are like very happy. So what I would say is each and every person's stress is different. So you need to look at what is going on in your life and what can be changed based on your personality, what all resources are available with you, and then go ahead with many things. When it comes to modifiable other factors, I would say is obviously avoiding any sort of substance abuse, getting a good night's sleep, eating healthy, being watchful or mindful, like he mentioned, being mindful of every aspect that we do, which we generally do, just like that, very unconsciously. You walk in, you work, switch on the TV, switch on, all these things we do. If you put in more effort and be mindful of what you're doing, even when you're having food, we'll have our phones in our hand, we're not focused on what we're doing. It's about practicing, savoring. You savor whatever you're doing, it's about pausing and savoring what you're doing. So that is very important. Those are the main aspects of,
Yeah, pretty much both of you have spoken quite a lot about modifiable risk factors, and including exercise, proper diet, healthy mind, healthy heart, everything follows. And Dr. Bigesh, can you give us a take-home message? I think we have come to the end of this talk, so both the doctors can give us a take-home message.
First of all, I would like to thank Dr. Samin, Dr. Romina, Dr. Sanket, Ashraf, and all the team behind this webinar, who has given their time as well as their dedication to make it a successful one. I would like to tell you a story where a teacher, the scenario is in Africa. The teacher asked the students for a running competition. What he tells is like, I will give you a bunch of sweets for the person who reaches and touches the tree the first time. So, in the contrary of expectation, what the teacher saw was none of them ran directly to the tree. Everyone together caught each other's hand, went to the tree, smiling, took the sweets and shared with each other, and even gave one to the teacher. So teacher was asking, if one of you could have run and you could have taken the whole thing yourselves. Then one of the students told, we believe in Ubuntu. Ubuntu everyone knows probably, or many of us doesn't know. We are here because all of you are here. We are happy because all of you are happy. Without your happiness, we are not happy. We can attain many things in life alone, running aggressively, pulling others' legs and reach the top. But at that position, we'll be alone. And the loneliness is the most important thing of sorrow and anxiety, depression, and all other diseases. This is very important in our scenario because we are all expats. In one or the other way, we are all alone. Our families are back home or they are with us, or most of our families may be back home. We are all here to earn and send money to the family for a good living. This loneliness will definitely create depression, anxiety, and end up in hospitals, especially youngsters with different forms of diseases, not true diseases, Not at all true diseases. Maybe a gastritis coming to a cardiologist. Maybe a panic attack coming to a cardiologist. How you can come out of this and maintain yourself happy is the key information which I would like to give. Maintain your connections. The foremost and the most important thing which I would like to tell, reconnect. Connect with your workplace friends. Make friends in workplace. Make friends in neighborhood. Make friends in your gym or in your clubs or whatever activities you are into. This is very important because suppose you have a fight with your friend in your workplace. Either you will be angry at him or because it is his mistake, or you will be depressed because it is your mistake. Before the blame games and all those things start, if you have a good friend in your circle outside that, a 5-minute chat will definitely help you to come out of the suicidal tendencies caused by depression or the anger mood which is created, which will affect your own health. Friendship as well as the circle building is very important part to increase the happiness in life. Number 2, before you sleep, daily, at least, just try to just remember something, at least one thing which has happened good to you on that day. Try to note that in a paper or book before you sleep. If you don't have anything, at least you can think that you are able to breathe well, you are able to hear or see. These are all blessings. Try to write 1 or 2 blessings daily at least before you sleep. This definitely give you positive, as well as you will be able to, the next day will be a blissful one for you all. Number 3, the most important thing is we always think we are all self-made people, but we cannot, no one is self-made. We all say self-made based on that we are not taking any financial help from our parents and we have reached some position. But without anybody's help, knowingly or unknowingly, you will never reach any place. So always trying to be showing a gratitude to the people who have helped you. At least planning a visit when you go back, or even visiting your own college, getting back those nostalgias, visiting your old school. All these things actually improves happiness in everyone. These are all very important things because there are studies which have shown a happy person, the life is extended. There is less diseases. So this is very important that I wish all of you to have a happy and prosperous journey of life. Thanking you all.
Thank you so much, Dr. Bigesh. That was a very wonderful message that all of us have got and a wonderful story. Hope all of you have got some points from that, definitely. Thank you so much, both of you. Now, I think we have come to the end of the session and we are open for question and answers. So we are receiving few questions from the audience. Shall we start discussing that, Mr. Sanket? Okay. All right, so let's see. The first question is, I think for Dr. Samin, because it's psychiatry related. I feel down and alone all the time. I don't feel like going outside and I get emotional very easily. I even have bad thoughts about myself. Any help would be appreciated.
In situations like this, what I would say is we'll need to evaluate further We cannot comment
without
on
seeing the person or without knowing. It's
because
difficult.
all these symptoms have to be,
evaluated
in detail. But definitely, I can understand that the person needs help. So coming in person would be the best thing to do.
Please come and visit him in Naseem Medical Centre, Searing Road, so he can help you. Because as you know, it should be understood that he needs to analyze you in detail. He needs to see you in person, like how is he, starting even from the expression. Probably, right?
Yeah, we don't have many tests. What we do is
all about the physical.
What we do is called a mental state examination.
Yes.
We take your history regarding from birth till now, what has been happening in your life, all those things.
Yes.
We do a mental state examination. We look at your emotions, your body language, all these aspects, and then arrive at what the problem is.
Yes, so please come and see Dr. Samin in person. Okay, next. What can I do when I'm alone and if I get increased heartbeats or an increased anxiety attack?
This is what I think we mentioned about
Yes,
this, no?
yes,
What
yes,
to do
we
when
did.
you get an anxiety attack.
Yes.
It's better if you have somebody with you. If you are prone to develop anxiety attacks, if you have somebody with you that will help, was being with them, with the person you know or you're comfortable with can help sometimes. In situations like this, it becomes a little tricky. So what happens is immediately they'll go to a hospital or something. Even if something like a glucose drip or IV drip sometimes
Helps,
that we
yes.
have
Some people
seen.
say, doctor, please put some glucose for me. I want to feel better. There are so many patients who come like that.
Yeah. Once they get that, I think it's better that they get checked it properly. See a cardiologist first, and then have a
Cardiology evaluation to be done
Yes.
first, and then followed by psychiatry.
Yes.
Okay, perfect. So we'll go on to the next question, which
That's
is
the
from
same
I think
question,
Mr. Kemal. Dear doctors, I would like to ask 2 questions. Are all these psychological effects related to neurochemicals such as serotonin, oxytocin, and dopamine in our brain?
Yeah.
That's
To
what
that, what I would say is these are few of the hormones or chemicals that we know about.
Yes.
I mean, of late there are many other neurotransmitters or
yes.
chemicals which have been identified, and it's a vast thing. There are many things
Which
that we
is
don't
not-
know about the mind as well. So maybe we'll talk about more things in future.
Yes, okay. Do you also believe that these neurochemicals are related to probiotics and our nutrition style?
Okay, that's a very good question. When it comes to probiotics, I'm very happy about that question. Why? Because one thing I would say is if you have a good tummy, you have a good mind. Why? Because there is this thing called the gut-brain axis. There's a big connection between our gut or our stomach and our brain. The neural connections are similar. That is why when you're feeling really anxious, we say we have butterflies. If you're happy or if you are anxious, you'll have butterflies in the stomach, you say. You suddenly feel anxious, you might feel like going to the toilet sometimes, you can feel constipation, dry mouth, and other things as well. So there's a big connection between our stomach and our mind. So many studies have found that probiotics, taking yogurt or other curd and other things which contains
These days
probiotics.
we see in the market a lot of products, especially this yogurt.
You need to look at whether it contains probiotics as well, because this probiotic bacteria is very important. If you have a good
gut health.
Gut health, that will take care of your mental health in a major way. And one more thing I would like to add regarding that is the recent studies, like Dr. Bigesh is telling about inflammation. It's a process in the brain that can happen, and it has been found that a lot of depression has been caused because of this process. So anti-inflammatory agents, we say. I would say turmeric is a very good thing that you can take on a daily basis. In fact, we are not using it as much as people in the West. Turmeric is being exported to other countries and being used in a major way, and there are many studies and valid papers which show that you can take turmeric in cases of depression and anxiety, and often they find that it's almost comparable to many of the antidepressant, anti-anxiety medications that we use. So many things that we don't know for sure whether it will work or not actually works, like probiotics, turmeric, and many other things as well.
Turmeric was something really, I think people really didn't know about it, so that's information. Then I think next question is for you, Dr. Bigesh. Depression or anxiety, which is considered as a risk factor for MI? That's the question.
As already discussed, both. It both comes under the psychosocial factors. which causes myocardial infarction. As I will again reiterate that it is the second most important modifiable risk factor after dyslipidemia. So we need to definitely tackle this aspect, and we have Dr. Samin here who will help you in this aspect.
Okay, then the next question is, what is the first aid for anxiety and panic attacks? I think you already mentioned many times, it's already told, so we don't want to repeat the same thing. Next question is, depression in women below 55 years considered as a risk factor for MI? I think, is that for Dr. Bigesh?
Yes.
Okay.
Yes, it is.
Nowadays we can't mention an age, to be honest. We see more young. I have a question to ask you. Why do young people get heart attacks more often nowadays?
Please, Dr.
Yeah,
Bigesh.
that is a very important question. Nowadays, youngsters, earlier, what we usually used to see is all people after 60s used to get an acute myocardial infarction. But nowadays, we are seeing those things more in youngsters. One of the most important thing is the lifestyle change, the diet and the exercise pattern which has changed over generations. The junk food and the new systems of eating habits is a major issue. Second is smoking, increased prevalence of smoking. We have seen in this center an 18-year-old guy, unfortunately a nurse, had history of smoking, presented with chest pain, and the ECG was showing ST elevation myocardial infarction, which was an unbelievable thing to her as well as her parents, his parents. So what I'm trying to, it was very difficult to convince the parents that this guy is having a heart attack. Unfortunately, he did not have a stent. It was a thrombosection was performed for him in Hamad, and he was relieved out of that problem, because smoking is very much related to thrombus formation in the blood vessel. So one thing which is must, which every youngster should understand, stop smoking to prevent not only heart disease but lung disease also. It's very important.
But to add to that question, see, we often think that being very healthy, being very physically active can help you with cardiac issues as well. But often we may see that people who play badminton or go to the gym regularly, still they get heart attacks. Why is that?
Yes.
I'm taking your role here.
Thank you, Samin, for the question. This again, what happens is in gym, when there are people, the thing what we should understand is whether the person is young or old, there is a lot of non-modifiable risk factors for people. Like for example, family history, very important factor which always we forget. We see a lot of young gym people who comes to OPD. When we evaluate them in a treadmill test, we see that it becomes positive. They go regularly do treadmill, they are not able to believe that the treadmill is positive for them. The reason is this very important thing. The family history is very, very, very important in people who are prone for heart disease. Please do have at least one cardiac checkup to know whether you are really fit to do this sort of heavy exercises in the gym or not. Because we have seen recently few celebrities getting into trouble just because there are people who were evaluated also before, but still during their gym activity they have collapsed and they had problems, especially sudden cardiac death. All the sudden cardiac death which is happening is just because of the arrhythmia which is caused due to ischemia. So this question is very important, and we all have to thank you, Samin, for asking such a wonderful question.
And Dr. Bigesh, I would also like to ask, like before, like children or even adolescents or kids who are the age of 18, is only smoking and alcohol related, or could stress, like, you know, at school or in university, such kind of causes also lead to cardiac problems? Because these days they say there's a lot of pressure for the curriculum, especially the CBSE is very tough these days. Most of the people, even the Indians, they send the kids to British school because of how tough the CBSE. When we studied, it was like you have to study CBSE. We didn't have any option. But these days, even the parents, they are having like so much of burden. They say that we don't want to take the burden. We don't want the kids to take so much of burden and put them in British schools rather. So do you believe that stress in schools or universities is also directly related to cardiac issues?
As we have already discussed, any form of stress, as I told you, the psychosocial factors, anxiety, depression, anger, hostility, any of these factors can definitely lead to a cardiac issue, for sure. So even if you are anxious and if there is a spasm of the coronary vessels, that itself can produce a heart attack. It is not only that the plaque has to rupture and you should have a 100% clot to get into a heart attack. So there are different reasons for heart attacks. One of the reasons is plaque rupture, another may be a coronary spasm mechanism. But those spasm, that doesn't mean that comes to these kids.
Yes.
That don't think in that way.
Yes.
I'm generally telling that coronary spasms also can lead to heart attack. But definitely stress do have a component.
Yes.
And they definitely require counseling from Samin do have a role there,
so
especially for child psychology.
Yes,
there's a big.
Yes.
Because they don't usually have, especially over here and all, they may not have a good social life, or when it's very hot and all those things. I mean, I think a good balance. There we'll say well, not work-life balance, study and other social life balance is very important, so that you have somewhere to, you know, let out the steam from your studies and all those things. So that is important, I feel. Yeah.
Okay, all right. So thank you so much, and we'll come to the end of the session. Thank you all for watching, and hope you have enjoyed the session with both the information from both the experts that we had today. And thank you so much.